So Joan is going to talk about the health access side of this more, Medicaid and CHIP and other programs. So Joan Alker, I'll turn it over to you now.
Okay, thanks so much, Chris, and it's a pleasure to be here with all of you today. Just a very quick word about the Center for Children and Families. We are a research and policy analysis shop based at Georgetown University, and our mission is really to ensure that all children and their families, especially low-income kids, have access to comprehensive affordable coverage. So we do that with many partners across the country and nationally, and it's always a pleasure to work with our colleagues at the Academy of Pediatrics and advocating for children. So thank you, Dr. Dreyer, for all your work. I'm going to talk today about children's health insurance status and then principally about public coverage, primarily Medicaid. Then I'll talk quickly about the delivery system and conclude with some questions that you as journalists might want to be asking going forward and as advocates for children. So I just want to start by saying that having health insurance is not enough to ensure that our children grow and thrive, but it is necessary. And we all may not love the way that our healthcare system is constructed, but the reality is that having health insurance is the price of admission. And if you don't have the price of admission, you're not going to see a good show. So we at CCF keep very close track on what's going on with the uninsured rate. And just last week, the Census Bureau released its annual data on many things, but including uninsured rates. And we are in the midst of putting together our annual report where we look at how states are doing, how we're doing as a country. And we hope to release that October 13th. That's the breaking news. But I'm going to share a few top lines with you today. I was quite distressed when we got this data last week. I didn't think it would be good, but it was worse than I expected. So what you see here is that for many years, our country was on a positive trajectory. There was a lot of support for covering kids. It was bipartisan, and this was really part of our safety net that was working. And if we can go to the next slide, please, you'll see here the uninsured rate, and it had been coming down consistently for years. And in fact, even prior to this slide, this particular data source we're using starts at 2008. And as you'll see, this predated the Affordable Care Act. The Affordable Care Act was largely implemented in 2014, and that did spark even quicker declines to our historic low of uninsured children in 2016 of 4.7%. But what you can see now is that since the Trump administration took office, that number has started to go in the wrong direction. And what we learned last week is that the uninsured rate for kids from 2016 to 2019, so of course, bear in mind, this is pre-pandemic data. The uninsured rate for kids went up a full percentage point, which means in this 3-year period, 726,000 children have lost their health insurance in this country. Now, as I say, this is pre-pandemic, so this is very troubling to think that we went into the pandemic with these kinds of losses and the numbers going the wrong direction. So our report will look at this more closely, but just a little teaser as we look at the state data, the huge increases in Texas. 1 out of 3 children losing their health insurance lived in Texas, and Texas now has just about 1 million uninsured children in the state of Texas alone. Really pretty shocking. So we'll stay tuned on that. Let's go to the next slide now and look at who are these children, what kinds of children are losing coverage. We'll be getting into this in more depth in our report, but this is a chart that the Census Bureau itself put out last week with the data. And you can see that with respect to race and ethnicity, that Latino children, who can be of any race, had the largest increase in their uninsured rate. And when we look at this last year over the 2-year period, looking at it again, what we're seeing is that white children and Latino children are seeing the statistically significant increases. And I'm going to come back to that in a minute. Also, we see that the poorest children are losing coverage. And in the past, interestingly, the poorest children had a little better uninsured rate because they're all eligible for Medicaid, with a few exceptions for undocumented children. The kids right above the poverty rate, kids who were sort of in those very low wage working families, had a higher uninsured rate. But unfortunately, in the last year, it looks like those poorest children are catching up. And now kids under 200% of poverty are uninsured at similar rates. That's again what we're looking at for our report. Here you'll also see that the South is the region which has by far the largest number of uninsured children. Texas and Florida together now account for 41% of the growth in the uninsured children. And states that have not expanded Medicaid to parents and other adults under the Affordable Care Act, their uninsured rate, as you can see in the bottom right, is about twice as high as those states that have. So all of those trends we'll be digging into further in our report. So why is the uninsured rate going up? Well, there's sort of three top reasons we've been pointing to in this period. First of all, we've seen repeated efforts to undermine the Affordable Care Act. Of course, 2017, Congress spent all year trying to repeal it, didn't at the end of the day, but again, the Trump administration did cut funding for community outreach navigators, community supports that help families understand their public coverage options, which can be quite complex. Secondly, we are seeing clearly now a very severe chilling effect. Excuse me, what that means is that, and you see this particularly with the Latino kids uninsured rate going up, is that we have a lot of children in this country who are citizens, but their parents are immigrants, and they are fearful because of the public charge regulation that this administration has put out and the many actions of hostility towards immigrant families that we have seen. Their parents are scared to sign them up for a government program, and there's clear evidence of that now. So that chilling effect, we didn't see so much in 2017, but now we're really starting to see that. And the third reason is more red tape. And we know this, those of us who work on public policy for public programs, that the more red tape the state puts up, the fewer kids and families that will be able to access that health insurance or that SNAP benefit, whatever it is. And those could be things like renewals happen more frequently. We check your income more frequently. The state sends you a letter, and if you don't respond within 10 days, they just cut you off. And they know that these things are leading to fewer people, fewer children getting benefits. And that's largely why they do it. So it's erecting barriers. And I think it's interesting. There's more and more recognition of this kind of red tape is a strategy that's being used across issues. You see it with voting rights, and you see it with public benefit programs. And in the name of clamping down on fraud, that doesn't really exist. But we can come back to that in the Q&A. So let's go to the next slide. So we're going to talk for a few minutes about Medicaid, and I encourage all of you who are covering state budgets. The State House is coming up. This is going to be a huge issue. It does not look like we're going to see any additional federal action providing more support for states in their Medicaid program. They got one round of an increase in their federal funds back in March, but it's really not enough. And we are expecting to see serious pressures on the Medicaid program in the budget year ahead. And look, Medicaid is right at the center of the multiple crises we're currently experiencing in our country. It is the #1 payer for long-term care. It is the #1, half the beneficiaries are children. And for low-income Americans, communities of colors, as we'll see, they disproportionately rely on Medicaid. So if we go to the next slide, a lot of times when people think of children's public coverage, they think of CHIP because it says children in the name, the Children's Health Insurance Program. And CHIP has been an important program to cover more kids and to raise awareness and to help get states do more outreach and simplify their procedures. But as you can see from these bubbles, Medicaid is really the ball game for kids. And even within those kids that are on CHIP, about half to a little more than half of them are actually on Medicaid. They're just being financed at a more generous CHIP match rate. And you can see here the marketplace, the Affordable Care Act marketplaces that we hear a lot about. They are not a terribly consequential source of coverage for children. So when you're thinking about kids, you got to really keep your eye on Medicaid. Let's go to the next slide. So here again, I wanted to really emphasize how Medicaid is disproportionately important for communities of color, who of course are being impacted most severely by the pandemic, both the health consequences and the economic consequences. And what this chart shows you is that while the majority of children on Medicaid are white, and you see that 57% in the gold bar there with white, that for the Black community and the Latinx community, and also it's hard to see, but American Indian, Alaska Native kids here also have very high uninsured rates. That's in a different chart, but it is disproportionately important to those communities. And so as we go forth and Medicaid is at risk of budget cuts, this is extremely concerning. Let's go to the next slide. So I'm not going to talk too much about this since Dr. Dreyer has covered this, but just to say, and we are working on a forthcoming report with the Commonwealth Fund that will review all of the peer-reviewed literature that looks at the long-term impact of Medicaid coverage. And it's things like more access, of course, to health services in the short run, but also in the long term. We see that kids who had Medicaid are more likely to have lower hypertension, lower chronic conditions, even lower mortality as adults. And here are a couple of studies that emphasize that Medicaid is actually helping to reduce poverty. In fact, this one study I cite here on the left found that Medicaid reduced the child poverty rate by 5.3 percentage points. That's very significant. So Medicaid is really one of the largest anti-poverty programs we have, even though we don't often think about it that way. And the other question I would submit to you is a lot of the discussion, a lot of the public discourse about Medicaid that we see these days does not focus on how fundamentally Medicaid is an economic protection. It is health insurance, and it's protecting those families from medical debt and helping them to access care like their child's asthma medication. So everybody wants to have health insurance because they don't want to be exposed to high medical costs, and that is absolutely the same benefit that Medicaid provides. And that often is not discussed when we hear discussions about Medicaid. Okay, let's go to the next slide. So I'm gonna just spend a few minutes now, and I know we are running short on time and I wanna leave time for questions, but just especially for all of you who are potentially gonna be writing about Medicaid, that we really need a lot more discussion in this country about how these kids are getting care and their parents and other adults, largely through managed care companies. Many of these are for-profit companies. You can see here the share of Medicaid beneficiaries in managed care, and it's growing. This is definitely the trend. It's really just, relatively speaking, a small number of very rural states that don't have managed care. This is a capitation that is paid on a monthly basis to cover the cost of the child's care, and the managed care company is taking the risk. So let's go to the next slide. So it's hard, it's very hard to track how this Medicaid managed care is working, and I'm not going to go through all of this. You'll have the slides. We do have some reported measures. There are a bunch of different sets, and we are expecting the federal government to release the latest data pretty soon, but those child core set measures are currently voluntary, so states don't report all of them. But by 2024, they will have to. So they should be getting ready for that, and some of them already do. So that's a good thing to look at to see how your state is doing, although you need some interpretation and call us, we can help with that. So here's just some data sources, but just to underscore that much more work is needed, in my opinion, to hold these managed care companies accountable, to improve transparency about what's going on the public dollar is being spent, how it's being spent, and if kids and families are getting the care they need. So if we go to the next slide, this is just very quickly, and thanks to my colleagues who did this work. This is not published, and it's just a look at websites of these states to see some of these basic things. Were these metrics publicly available? And you see that consistently speaking, they weren't mostly all available. So lots of work to be done there, but we can come back to that in the Q&A. So let's go to the next slide. I just want to finish with some questions that all of you can be asking, that you can be tracking. Obviously, there's this fundamental question of, is your state going in the right direction or the wrong direction with respect to the uninsured rate? And what policies, what kind of red tape does your state have to ensure that kids and families are covered and they're staying covered? We don't want kids to have gaps in coverage. They need to be covered continuously. And if they're losing Medicaid and CHIP, does your state have good data to tell you why? They may say to you, well, yeah, they won't say this anymore, but last year they were saying, it's a good economy, they're fine, they're losing Medicaid because they're getting jobs in employer-sponsored insurance. But we know that that's actually not true because the uninsured rate has been going up and those kids have been falling in the gap. Secondly, lots of important and interesting work to be done on maternal and infant health. Dr. Dreyer talked about some of the racial disparities here. You can look at how do your state's outcomes compare, particularly by race and ethnicity, and states do have some useful data on that. Quality, we just talked about that. Again, there's really not great data, and we need more, and we need more of it broken down by race and ethnicity. And then the last piece I wanted to emphasize, particularly now that we're in the pandemic, is this is sort of a technical term, the medical loss ratio. But what that refers to is how much of the Medicaid premium dollar are managed care companies using for healthcare versus profits and administrative costs. And that's a really important question, especially right now. We know that during the pandemic, there's been a decline in utilization of non-COVID related care. And while that utilization is coming back, it's been coming back much more slowly on the pediatric side, which is very unfortunate and is causing a host of issues that we can discuss. But those managed care companies are still getting those monthly premium payments. And yet many of the safety net providers are suffering and the kids are not getting care they need for a variety of reasons. But that's just something I wanted to flag and call your attention to. And then if we go to the last slide, just to note that we do have on our website here, you can see the link, an interactive data hub, and you can look at a number of these metrics, not all of them, but you can look by state, and we'll be updating this in the next couple of weeks as we release our report to see how your state is doing. So with that, I'm going to hand it back to you, Chris.